Hey, this is Dan from Carestream Dental. I'm going to talk a lot about detail in CBCT in this video. In general dentists, this is going to be both for you guys and for my colleagues. This is going to be some information that sales reps don't really talk about. And I promise you, it's going to seem a little heavy, but it is super important if you're, looking at CBCTs for your practice, or you just want to learn a little bit more about how CBCT works and how detail presents in CBCT. Carestream Dental is very popular in endodontics, and I hear it from time to time. General dentists think that Carestream Dental CBCTs are specialist equipment. They kind of are. They are to the endodontists who buy them because they like our stuff. But the reasons why they're important to endodontists should be the same reasons they are important to you. Unless you're buying a CBCT just for doing implant treatment planning or just for, doing airway or something like that, that's one thing. But if you are a restorative practice, CBCT is not for treatment planning. That shouldn't be the reason why you guys are buying CBCT. It should be for, eliminating the variables that narrow down the options in terms of what's going on with your patients, what the situation is, why are they in for pain, why is the are the 2D X-rays and the evaluation not lining up with the patient presentation. This is where CBCT comes in, and it significantly, at a significant rate, clarifies what it is that you think that it is, or overall changes the decision. We're talking, in some studies, up to 86% of the times when CBCT is indicated, it is either clarifying or changing your decision. So, CBCT is first and foremost a tool for diagnosis in a restorative clinic. But what we're looking at here is we've got the tooth, we've got the periodontal ligament, we've got the lamina dura, and we've got the bone. And for anybody who's ever heard me talk about detail in CBCT, what I'm talking about is the ability to discern these different structures clearly when zoomed in. Okay. So that's why we've got things zoomed way in right here. So what we're looking at here are a small periodontal ligament is going to be in the area of about 150 micron. Think about periodontal ligaments, or think about canals, partially calcified canals, narrow canals, other smaller structures. Okay, and this is going to apply to all of those things. So the reason why I chose 150 microns is because the standard resolution scans with Carestream Dental CBCTs are 150 microns. All right. And we can tell, just as we're looking at these 150 micron voxels inside of that space, why right away we're not going to be able to see, the variation in those shades of gray, to be able to see how those structures separate. Okay. So we're going to zoom in on that just a little bit. Again, this is going to be all simulated. This is all going to be best guesses. I'm not going to give away any, manufacturers' names, or we're not going to narrow things down to anybody specifically. This is all just for educational purposes. So we are not capturing the most accurate information here with standard resolution scans. This is kind of a good enough to look at broader structures inside the mouth. Now, what Carestream Dental does is, and this is really important, okay? This is what separates Carestream Dental from most other manufacturers out there, is that we capture a lot of base image sample data during our acquisitions. We are capturing, no joke, up to, at a ratio of 4 to 1 compared to other manufacturers when we're capturing that original base data. We are capturing one shade of gray per 1 pixel in the sensor. It is a difficult thing to do. Carestream Dental's been at this game for a very long time, and we have been able to accomplish this now. But what we're looking at is we are looking at much more detailed variation in those gray shades, which, as you can kind of see here, is going to allow for being able to see those separations much better. Now, this is kind of how that presents. All right. And what we're looking for is we're just looking at the clean separation here of these structures. Even the most narrow canals here, even fractures. Though CBCT is not the right tool for necessarily seeing cracks and fractures in teeth. You're more looking at what the bone's doing, but a finer detail is going to facilitate the visualization of that better than others. Okay. Now, what we're looking at, I mean, this is a static image. All of the images here are going to be static, so it's not the best thing, but we will get an idea of what we're looking at here. What we are seeing with this narrow canal here is not entirely perfect. We cannot make these perfect. The math, the science just isn't there yet. Maybe someday it will be, but it's not yet. This is about as good as it gets, bar none. Okay. What others do though, all right? So we I took the standard resolution scan. This is the starting point for a lot of other manufacturers out there that are acquiring scans and then creating high resolution scans. They take these lower sample size images, and then they are using math basically to split uh, that information out, use math to average out what those shades of gray are. Okay, so with this binned scan, what that means is they are acquiring one shade of gray per 4 pixels in the sensor. That's 2 pixels by 2 pixels for a total of 4 pixels, all right? And then they get one shade of gray out of that, where Carestream Dental is capturing one shade of gray per 1 pixel in the sensor. So, and then they take that and they use math to separate those out, and then they guess what all of those gray shades are. Now, the problem with this is that we never had the accurate information to begin with. So, all of this is based on the best guess of what those gray shades are based on the neighbors, and this is going to be kind of how that presents. And if we're looking at that, there's going to be more blending of the structures. There's going to be more, you're going to be able to visualize more of the lines that represent aliasing, which is a direct result of undersampling in that CBCT scan. Okay, that is aliasing artifact is how undersampling presents. Blending artifact is how undersampling presents. So what that means for you is that where we have these structures blending together, you're not going to be able to see those narrow canals better, those partially calcified canals. And I'm going to tell you this. I've been doing this for a while. I get a lot of general dentists that come to me, and then they're looking at Carestream because they're unhappy with their ability to see canals in their CBCT scans. And maybe you're one of those people. Now, there are some variables that are involved with that. The scans that I've chosen for this video are very well acquired scans. The parameters were good. The patients did what they were supposed to, and they're good scans. So now the variables generally relate to that. So ease of use, ease of use of the software, comfort for the patient. Those are all very important things that relate to varying average image quality as well. But the actual capture of the information from the start is a just an absolute limiting factor right from the beginning. So it's worth paying attention to. And this is kind of the difference here. Again, this is a simulation, but we can see with the way that we acquire it, one shade of gray per 1 pixel as opposed to one shade of gray per 4 pixels. We've got a much sharper spatial resolution, a little bit better contrast resolution, and with some there's some variables there too. But we are going to be able to see those separations better. Okay, and this again is how this presents. Let me know. I hope this helps you out. But if you have any questions, I love answering questions. You don't have to be one of my customers to reach out to me. And I hope you guys all have a great day.